Hi everybody, it's Valerie Sayer from Nutrition Connection Balance, and I wanted to have a little bit of a conversation today about hormones. And I have been working with men and women around hormones especially since 2002, when I was the director of a compounding pharmacy. And since that time, it is 2026, I have worked with thousands of men and women to deal with hormone issues. One of the things that I used to do was workshops, and it's time to do another workshop. I'm hosting one on February 21st from 11 a.m. to 2 p.m. Eastern, and it's super affordable. But some of the reasons that you want to get into this particular workshop, if you're a woman 18 to 100, it's perfect for you. There are many things we are not taught. We're going to be talking about the different types of estrogens. There's actually 3, but now there's 4. So there's one you may not know about. There is actually a lot of evidence around different types of hormones and how they influence even the partner you pick when you're a younger woman. We certainly will be talking about different forms of hormones. We'll be talking about the FDA and the new announcement in November 2025 that it is safe for women, which I have always implemented and used. However, what I'm seeing is all these podcasters and all these people that do not test patients that are jumping in and putting pellets in or putting cream on people or just recommending a hormone without any testing or even knowing what estrogens they're giving someone. Then we have to also look at different stress hormones, the adrenal glands. They directly influence how your hormones work. And in women, they directly influence each other. So if you have low testosterone, it could be because of low hormones. It could be insulin or other issues, or it actually could be low DHEA. And so it's really important that you look at that whole picture. You know, you would not say that you feel like you're diabetic and a doctor just gives you insulin and says, go see how you feel. You monitor it, you test it, and then you look at that, how each hormone affects you and how you can apply that so that you have that individual care and not just affect your symptoms, but really help you stay healthy, keep your brain healthy, and all your tissues healthy. We're going to talk a lot about the urinary system and what is normal, what is not. We're going to also talk about different exercises that affect the pelvic floor. And then we're going to talk about different intimacy issues from age 18 on that are things that I certainly never knew until I was older. And what a shame, because things from lubrication to moisturizers and to different techniques help with intimacy, orgasm, having less pain. And of course, we'll be talking about all those things over a 3-hour period. So it will be very relaxed. It will be live, and then we'll also have a Q&A for 15 to 20 minutes out of every 45 minutes or so that we can make sure you get what you need. If you could not attend, the good news is we will record it, and then the recording you will get and you can use. I also highly recommend that you register and you host some other women in your home. So then everyone can pay $5, $6, $7 for the $50 fee and all listen together. And I really look forward to helping you navigate, learn more so that you can figure out if and when and what type of hormones you need. If you're experiencing fertility issues or you want to get in good shape for fertility or after having a baby. We have all these different cycles that happen in a women's lives, from before we get a menstrual cycle to the menstrual cycle to PMS, then to premenopause, perimenopause, and then postmenopause. And quite frankly, perimenopausal symptoms and hormone changes are happening for most women around age 35 now, up till around age 50. And then average menopause is around 50, 51, give or take. So there's a lot of things we'll be covering, and it really would be very helpful for you to attend. So again, you can register and then you'll get a link. And if you cannot attend, you will get the recording. So I look forward to helping you navigate the hormones, different types of birth control, making sure that you know all the different things you need to know to navigate throughout your life as a woman with hormones, adrenals, urinary system, intimacy, and the pelvic floor. All right, you guys, take care.